So, Bob, now that the dogs have properly mauled you as they greet you at my front door, and then you took a picture of the coyote in my backyard.
You have a coyote in your backyard.
Which you named Carl.
Which
makes sense.
Yeah.
Now that you're sitting down, and we took our selfie that we're going to post on Instagram, because we're wearing matching shirts.
Shirts, yeah.
And I gave you that picture of you and your wife.
Oh, yeah.
That I framed, that I took, that I thought was really cute.
Thank you.
Let's finally answer some emails. What do you say?
I say yes.
Highest tier patron Natalie from Dallas. I have been previously diagnosed by a psychiatrist with borderline personality disorder. However, I have some issues with said psychiatrist. She has told my parents prior to my actual assessment that their concern, that my parents' concern, that I had borderline. So this is worded a weird way that I can't say. So essentially what Natalie is saying is that the parents thought she had borderline, and the psychiatrist said that wasn't founded because she's the doctor and the parents are not, essentially what she said.
Right.
So when you just hear that, what kind of thoughts come to mind?
Maybe they feel protective of Natalie and want her to... Maybe they feel protective of Natalie and they have a view that the diagnosis of borderline personality disorder is like a bad thing.
Right.
And they maybe haven't worked that out for themselves yet, that, it's like saying somebody has a broken arm. Well, they do have a broken arm. Great. We should get it treated.
Right.
They do have borderline. Okay, fine. Good to know. Let's work on it and not treat it like she's like some kind of second-class citizen.
Right.
Yeah.
Yeah, that was my thought immediately, was that the psychiatrist is like, it's a bad thing that she has borderline. And I have a experience or a policy or an approach that, or a bias that when parents claim their kids have borderline, I always push back or something. That's what it sounded like to me.
Right.
Then we go on. And if she wasn't a psychiatrist, I would wonder if she even used diagnoses such as personality disorder at all.
Right.
But psychiatrists typically are pretty down the middle when it comes to mainstream DSM followership. You know what I mean?
Yeah, they are.
Maybe not personality disorders, possibly, because, you'd have to, at the very least, go along with depression and anxiety for the meds, ADHD. But it's not common for psychiatrists, anecdotally, to just categorically not accept the construct of borderline.
I haven't heard of it.
Yeah, but so it's likely that the psychiatrist is on board with the label, but without an assessment, just assumed that the parents were off kilter. Now, there's a lot of possibilities. It's also possible that the psychiatrist was hearing things from the parents that said, well, that's not borderline.
Right.
So it's also possible that Natalie wasn't there during the conversation and just heard it from the parents or something. And so, I don't know. It's hard to know. But anyway. Going on, Natalie says, despite after around 6 years of being observed by various professionals who said I had traits of borderline, but they would never diagnose me. When the psychiatrist diagnosed me, it was only after I told her I thought I had it. And she simply said yes, without telling me how I specifically showed symptoms and what I needed to treat. So when you hear that, what do you think might be going on there?
Can you say it again? I was thinking about it, but also something else.
So Natalie going to many different therapists.
Yeah.
The therapist would say that she has borderline traits, but they never, according to Natalie, diagnosed her.
Yeah.
She goes to the psychiatrist, who initially tells the parents to F off. She doesn't have borderline. But then Natalie tells the psychiatrist, I think I have borderline for these, or even, I don't know. I don't know how much depth she went into, maybe not much. And then Natalie says, the clinician just says yes, and then they just sort of move forward
with that
without having an in-depth conversation. So when you think about that, well, let me go on because there's a little more.
Okay.
Since then, it has only been short follow-ups, which with what feels like me being dismissed and not listened to in general. I'm very frustrated with this since I know how borderlines are viewed by professionals, and because of that, I'm scared to be switching providers away from the psychiatrist, even though I feel that might be what's best for me. I don't know if this is just a cognitive distortion due to borderline, or I'm being totally devalued by this person. Is that what it might be? What do you think, Bob?
I think this would be a good thing to talk about with the psychiatrist and let them know that you don't feel like she's like she's talking to you like, human to human, person to person, that are in an endeavor of helping mental health, right? Like that's why people meet with psychiatrists, is so that the two can team up and get things, whatever the things are, get them better. And you feel like you're there kind of being operated on by somebody with a clothespin over their nose. And, maybe you are too, but I wonder if it would make sense to like have a come to Jesus, like just talk about it. Mm-hmm. Do you have a prejudice against that diagnosis? Do you look at me funny because of it? Mm-hmm. Are you somehow frightened of me? Mm-hmm. What are you swayed by the general prejudice of your field? Because Natalie is accurate. There is a lot of prejudice about this. Nuts, but it's there. It's funny that's nuts. It's sort of ironic. Yeah. But one of the things that occurred to me is we don't know anything about the assessment, but you can actually just assess the SCID-2, right? The SCID-2, the SCID-2. Isn't that what people use to assess personality?
Well, there are various different instruments. That's one.
Yeah. I think most of the time people just sort of rule of thumb it. They're just like, well, yeah, it looks like it, and so therefore it's true, as opposed to actually some kind of assessment with rigor. It's sort of rendered as an opinion as opposed to as a, objective is probably a bit too strong, but perhaps a more objective measure.
Yeah. You could also just go through the criteria of the DSM,
right,
and just say, I think I have this, and let me tell you why. But yeah, I agree with Bob to bring it up.
Yeah.
There's a lot of benefits to it, because it sounds like it's been barely talked about. Yeah. And so the sky's the limit in terms of what's happening for you, Natalie. The psychiatrist could be completely incompetent in a variety of ways, or completely competent, and you just haven't heard that information. And I would also expect, Natalie, from my psychiatrist, that they prove to me that they get it. Like, you could ask the questions like, what do you think about borderline? And say they answer the questions, but you still don't feel quite safe or knowing what they think about it. Then you have every right to say, look, I'm not going to be able to move forward until, or it's going to be hard for me to move forward until I feel like I understand how you feel about borderline and what your approach is, or what your whole process was with me. Why did you tell my parents that? You have every right to say, prove to me, fully explain to me what's going on with you with this. And until I feel like I get you, I'm not going to be able to move forward. You have every right to do that. It's an important relationship. And now, there also, I don't know for you, Natalie, if this is a psychiatrist that is doing psychotherapy. It kind of sounds like maybe, but it also sounds like maybe not.
Yeah.
It's possible that your psychiatrist doesn't even care if you have borderline, because there's no med for borderline.
Right.
So it's possible that it's just a med management conversation with kind of mild check-ins.
Yeah.
So if that's the case, then I wouldn't bother at all, because it doesn't really matter what your psychiatrist thinks about borderline or not. You know what I mean?
If you're using meds, are they helping?
Right. So, and there's no med for borderline. Right. So there's that.
Yeah.
Now you ask, might you be distorted or not? And it's hard to know. There's a chance that you're not. Absolutely. I mean, the way you lay it out, it's possible that your conclusions or perception is as it is. And it's good to ask that question if you have borderline traits. It's like, what's going on here? Yeah. And to ask other people. It's possible that it is distorted. It's possible it's just a misunderstanding that anyone would have, regardless of having borderline traits. And then you ask, is it a valid concern? And obviously, Bob and I are saying yes. In fact, I would say it's the primary concern. I mean, the two most fundamental things are, does my clinician understand me? And two, do I feel safe talking to them? So those are fundamentals to all therapy. And if she's a good psychotherapist, and even if she is a psychotherapist, then of course she would value that kind of conversation, especially if you lay it out that way. Also, you ask, and if this is a valid concern, what is the best way to approach finding a new provider who won't stigmatize or discriminate against my diagnosis and issues? And what I would say to that is, it's not necessarily the best move to do that at this point. I would, give the psychiatrist a try. But if you do decide to jump ship, you need to look for someone who claims to specialize in borderline, which is not uncommon. But then I would interview them on the phone about their approach to borderline and see what they say, because there's a fair amount of people that will have extremely simplistic answers to that, and I would ask to interview them over the phone prior to. And I wouldn't say, I'm scrutinizing you. I'd just be like, hey, so you say you specialize in borderline. I don't want to get into my issues, but I'm just curious what your approach is to that. And again, you have every right to get 5 minutes. Like, it wouldn't take me long to convince someone that I knew what I was doing about borderline. I could, depending on how articulate I was at the time, it would probably take me 5 to 10 minutes, maybe even just 3 or 4 sentences. You have every right to ask for that and to feel like, and this just goes for everyone out there, when you're going to a therapist, you have every right to have those questions answered prior to investing the time and the money and the effort into starting a relationship with a therapist. And it's not guaranteed that they are going to understand what's going on with you or that they even know what they're doing. So, and I apologize on behalf of my field because of that. And I apologize that it's hard to find a specialist. Like, when you're looking for a dentist, which is a specialist medical professional, it's not hard to find a freaking dentist. You don't end up in a foot doctor's office and they claim to be a dentist, a tooth specialist, and then like 6 months into the therapy, you're like, oh, so you don't? Because on your website, it said you did specialize in teeth, but now you're telling me you don't? Oh, or you realize that they're incompetent with teeth, but they're pretty good with feet. Like, that's not how it is in the medical field, but it is in our field. And it's ridiculous. It's like, we're stuck in some model from the 1800s where people literally hang a shingle and you just got to take whatever kind of quack happens to be down the street. It's really a terrible, and I know a lot of people have been trying to fix this problem with different databases. In fact, I had a number of years ago, a startup CEO who was trying to get a directory off the ground. He was trying to make it much more, usable, and it would be outside of Psychology Today, and it would be free for people, And I don't think that ever got off the ground because we still haven't seen that thing. Yeah. Psychology Today is still the thing,
which is basically classifieds.
Yeah. And it's useful, and I'm glad it's there, but it's not the best, and not like I'm not on Psychology Today. And I have other colleagues that aren't either. You have to pay for it. Like you're on Psychology Today. Actually,
$30 a month.
Actually searched you the other day.
Oh yeah?
Yeah. Because I was updating my referral list.
Well, the thing about Psychology Today, it's self-report. Like, do you specialize in borderline? Do you specialize in ADHD? Whatever. Do you And so you just literally, there's a long list, and you check whatever box you wish to say you fit into.
Yeah. Exactly.
Yeah.
Anonymous upper tier patron, she says, to Kirk and Bob, I have disorganized attachment, anxiety, and borderline personality disorder traits. I've been in therapy for 6 years and have learned to manage my triggers quite well and have good insight into my attachment needs. I've been dating someone for almost 3 years who has avoidant attachment and what I suspect is narcissistic personality disorder, or at the very least, traits. He also self-identifies as a sadist, but in the same breath calls himself an empath. So just chiming in here, I don't know what he is referring to as identifying as a sadist and an empath, but I'm guessing what that means is that he either has a sexual sadistic kink, or he actually gets pleasure from seeing other people suffer in general, or thinks he does and knows that about himself and tries not to act on it, because there are, similar to pedophilia, sadism is something that is gaining some awareness, which is good in our society, because they're not necessarily monsters, and they're not necessarily people who don't have empathy or remorse or compassion for other people. You can have sadism. Certainly there are sadists who don't have compassion or care for other people, so they're psychopathic sadists. But in the same way that you can be a pedophile and not actually want to hurt anyone, you actually care about children, and you don't act on it. You don't want to hurt anyone. And so we need to recognize those people and help them, because they might have impulses that need some management system, and they can't be shunned from society and denied attachment needs and all that kind of stuff. So I don't know what he means,
Right.
anonymous patron, when he says I'm a sadist. So there's that. But then you also say, in the same breath, he calls himself an empath. And I'm guessing what that means is that he believes that he's very attuned to other people's emotions, like abnormally so. And I would guess that he's in the category of individuals who have relational traumas that led to them being, they needed to be very paying attention to their parents' emotional state, because abuse would hinge on knowing that.
Right.
And thus they just retained that laser focus and competence, that they're much better than average than others. And they probably distort a fair amount too. And because the typical person who identifies as an empath in my anecdotal experience is someone who distorts a fair amount. Like, they're the sort of people that will walk up to me and say, "Oh, you look really upset today." And I'm like, "Nope." And then how do you prove a negative? It's like, I'm not upset. I don't know why you're saying that.
Right.
You know what I mean? But they're convinced, because they really feel it, and they're distorted. So
Feelings are not facts.
yeah, your observations might not be true.
Yeah.
But they're and so the typical person that identifies as an empath, in my experience, they're extremely sure of themselves.
Yeah.
You know what I mean? Not all of them, but anyway. And of course, there's a supernatural component for some people that will claim they're empaths. They're like,
So like this self-aggrandizing kind of thing?
maybe, but also there's a new age religious point of view that some people are just into, like they'll use quantum mechanics as some justification for the ability to sense other people's string theory vibrations and stuff. They're messing up all sorts of quantum mechanics and string theory and applying it to their ability to...
Sounds grand.
Yeah. But it's a religion, it's a belief system, and it's one of those things that people believe. Anyway, last year I tried to end the relationship with this guy who claims that she's a sadist, empath, and might have narcissism, which led to him begging, screaming at me, and him breaking things. Okay, that's abusive and criminal. I ended up staying under the condition that he and I would continue to work on ourselves and that he would work to be more considerate of my feelings. A month later, he ended things abruptly through text, stating that I was a reminder that he's abusive and that I make him unhappy, so he shouldn't be with me. We ended up getting back together a few months ago, but things are back to how they were with the abuse and with me questioning my own sanity. That's gaslighting, by the way. This time, however, I feel like I'm very emotionally attached to the point where I'm terrified that he will leave. I know the relationship isn't sustainable, but I don't even know where to begin to end it. To me, it feels like I can't be without him. Any thoughts on how to rationally detach and make rational decisions about the relationship? Bob, what do you think?
Sounds like the person already knows what to do and finds herself, I think, afraid to do it. And I'm sorry. I know it's really hard and it's really scary. And your body, it's like our bodies aren't set up for breakups. They're set up to stick around. They're set up to stay in. So to your nervous system, you're like taking your life in your hands. And so that's real in that it really is happening in your nervous system. But when I said earlier that feelings are not facts, what I meant is that feelings don't necessarily point to facts. Just because I feel it. We feel sad when we don't have a loss, and we feel scared when we're not in danger, and we feel angry when there's no threat, and shame when we haven't done anything bad or wrong and aren't being rejected, and guilt when we haven't done anything bad or wrong. We feel those things, and they're worthy of our attention, but it doesn't necessarily mean that they need to be heeded. Feeling it's complicated to be a human, because not only do you have these feelings that are sort of compelling energy and they move you fast and da-da-da-da, but they also are at times distortions. They are at times not reflective of reality, and so they can be disobeyed. And in the disobeying, ultimately, it's most likely that they'll subside. So it sounds like you know what to do. You know you want to end your relationship, and you find yourself terrified to do it. Totally get it. I can't imagine really feeling any other way. You are attached, and if it makes your life better, then maybe it's just time.
Yeah. In addition to that, I'll say, I know you're in an abusive relationship. That's factual. But it's possible that your feelings are actually part of the gaslighting process, that the way he abuses you mentally, physically, he's breaking things, screaming at you, that he is getting under your skin and creating thoughts and feelings inside of you that aren't really yours. So who knows? But I would think about the severity of the possible distortion that you might actually identify years from now after you get out of this little mini cult. I mean, it doesn't sound severe, but it's possible. So I would be very skeptical of your interpretation of this love feeling, or this I can't be without him feeling. A lot of victims of abuse will believe that, particularly if they have abuse histories in their childhood and have disorganized attachment. So it's a serious thing, and you can't just say to yourself, well, I'm going to white knuckle this and figure I'll find the courage one day, because the longer you wait, it's possible the more gaslighting you'll experience and the more indoctrinated into a mini cult you'll become. And along those lines, I would recommend seeking support from a DV specialist. A therapist who specializes in it would be ideal, but maybe an advocate in your area, or a friend that got out of a relationship. Another support group that actually is right down the middle, geared towards people like you, is what they call Love Addicts Anonymous, Relationship Addicts Anonymous. What you describe is what they are geared to help people with. So I might look into that. I would also try to get support. I would also try to differentiate more in, not only you from him, but also between your thoughts and your feelings. You have a feeling that you can't be without him, but we all know that you can be without him. There's nothing that he gives you that you need to survive. It feels that way because it's triggering the attachment injuries and abuse that I'm guessing you went through as a child, but that's not what's happened. So you have to differentiate that. It feels dangerous to leave him. It feels like I can't live without him, but I know that that's ridiculous. Yeah. In fact, it's possible I'll be much more safe without him, So I would think about that. And I would also try to replace attachments. So because this is something that I find is not talked about enough, that for people with borderline or dependent personality and they're in an abusive relationship, this is where that stat comes up where it says that the average person goes back 7 times or something like that. And a good portion of that is because when these victims find themselves finally alone, they have tremendous anxiety because they literally have no one else to turn to. The abuser has excised all their relationships, or they just don't have any secure relationships. And our drive for security outweighs our drive for safety. Yeah. So if you have no security, you will run towards the flame to get secure. You will run towards the abuser to feel that feeling of someone loves me, someone knows me, someone cares about me. You will run towards that. So if you have no one else that cares about you, or you feel cares about you, or that would be there for you, then it's almost impossible not to go back to the abuser. So it's very important that you cultivate relationships with other people. Now, you might be in a catch-22 because he might actually prevent you from doing that if he's abusive. But the first thing I would do is I'd find a therapist that specializes in victims, and because that person would meet with you once a week, could coordinate with these other folks, could guide, could explore. Typical experts like myself in this area would never pressure you to leave. It could take a while. I've worked with victims for years before they left their abuser, not because things were failing, but it was complicated. And I, in my mind, wished they would leave. Sure. and might even say that sometimes. So I'm just going to come clean and tell you, like, I kind of wish you would leave, but I don't know. I'm not going to tell you that, that I even know, but it's coming out my language, because sometimes it'll influence my language and my tone.
Sure.
And then I just feel I just need to tell this person, because
own it.
Yeah, because sometimes halfway through a session, because I'm seeing so much abuse, I'm seeing so much harm, that halfway through the session, I'll lose differentiation myself and start to countertransferentially attack the victim for not leaving, trying to take over. And I will notice that 5 minutes in, hopefully, and then say something. But sometimes it's literally like the next week. I'll be like, by the way, last week I lost different, because I care about you, and it's hard for me to hold on to my professionalism and what I believe to be helpful. And I became personally involved, and I apologize for the tone I took with you last week, because it can get kind of bad. I'll be judgmental. I'll be like, but you could imagine that happening. But anyway, let's take a break. Get back, more emails. What do you say, Bob?
Yep.
So, Bob, let's do an OPP.
Yeah. Where you at?
Old patron page praise. We're in June of 2020.
Wow.
These people became patrons all the way back then. We have Mohammed from Woonsocket, Rhode Island.
Oh, Woonsocket.
You know
they
that?
Make, I think they make like notebooks there, like for, like high school, like for school products.
Huh. Dana from Houston. Carrie from God knows where. Carl, good old Carl, from Windsor, Ontario.
Wow.
Annual patron. Natalie from Hong Kong. Upper tier patron Janet from God knows where. Mariella from Netherlands. George from Bangor, Great Britain. We have Shay, upper tier patron Shay from Plano, Texas. Natalia, Tiffany, Skolas, Emma, April, C. Gia, Janine, Heidi, Claire, Lahel, and Arwa from God knows where. We have Angie from West Sacramento, California. Jennifer from Calgary, good old Calgary, Alberta. Home of the 1980 Winter Olympics, I think, 82.
Wow, shit.
Ludwig from Berlin. Amanda from Covina, California. Chien from Irvine, California. Perna from Pittsburgh.
Pittsburgh, great city.
Do you like Pittsburgh?
I do.
You don't like Philadelphia?
Not my favorite, no.
What do you like about Pittsburgh?
Oh, it's just a great town. It's really nice there, and they have yummy food, and it's beautiful. Yeah.
Oh. It's on a river, is it not?
Yeah, Three Rivers.
Oh.
Three Rivers Stadium, the Steelers, Three Rivers. Well, they don't play there anymore because that's gone, but yeah.
I hear Pittsburgh's kind of like a little Seattle.
It is.
It has like a lot of tech.
And used to be a steel town. Now it's tech town, I think, if I remember right.
Upper tier patron Hannah from Indiana says, Kirk and Bob, can you talk more about Butler syndrome, disorganized attachment, and share your thoughts on my metaphor of feeling like a guest in my own life? I have disorganized attachment and traits of borderline personality disorder and OCPD. I often describe my lack of self as feeling like a guest in my own life. When I voice my own needs, I genuinely feel as if I were walking on someone's new carpets with muddy shoes, or that I'm taking someone's last ice cream sandwich without asking. Does that resonate with you, Bob?
Yeah. Yeah, it does.
How so?
Well, I don't finish things. Like if we had a jug of milk, I won't pour the last of it into a cup. I'll leave a little splash at the bottom, which I think Colleen finds annoying. Or if we don't eat cereal anymore, but when we used to, I wouldn't finish the Raisin Bran. I'd just leave a little bit. She liked the crumbs at the bottom. I know most people do not. I do not care for the crumbs, but she liked the crumbs. Anyways, but I don't finish them because I think I feel like I'm taking the last bit of the thing, or I'm responsible for the garbage now, or I don't know what. Yeah, right. So anyways, last ice cream sandwich.
And walking on someone's new carpets with muddy shoes, feeling like a guest in your own life.
Yeah.
How does that resonate?
I don't know if I ever felt like a guest in my own life. It sort of implies I had an invitation.
You're an intruder on your own life?
Yeah, right.
What do you think that Hannah means by that?
I think she means that she feels as though she imposes on others. that she's a guest in their lives, and therefore, a potential burden or whatever. And so that's probably, exaggerated or distorted or just plain old manufactured.
Yeah.
Yeah.
I mean, just imagine making a child feel that way chronically, such that as an adult, they permanently feel that way.
Yeah.
That the child is an intrusion.
Right.
It's just awful.
Yeah. When I was in fourth grade, me and my mom took a day off. We played hooky. And we went down to Philadelphia. This was 1976. I was really interested in the bicentennial and I was in Philadelphia.
Yeah,
so
that was big.
you were into that.
Yeah. I mean, even out here in Seattle, the bicentennial was like a whole thing that we were doing back then. Yeah.
So we went to the Franklin Institute, which is it's like a science center. And we went to a movie, I think on that day's version of the IMAX. I don't think they had IMAX, but we went to a place like that and ate lunch somewhere or something. I don't remember. And we were walking by some shop, and it's bicentennial, so they're selling Liberty Bells, little models of. I think we might even have gone to see the Liberty Bell that day or something. And I said, "Can I have one of those?" And it was like a pencil sharpener, like a little souvenir pencil sharpener. And she said no. And it's funny. I didn't think much of it. And then, I don't know, maybe about 10 years ago, she bought one and she gave it to me. And she said that she forever felt bad that she didn't just say yeah, because it was like a stupid...
Wow. She found the exact one?
I don't know. Yeah.
How long ago did she give you this?
About 10 years ago.
So 35 years later.
Yeah, that's about right.
She's like...
carried around this lifelong feeling.
But did you remember it too?
I don't remember feeling all that bad about it.
But do you remember the event?
Oh, sure.
So you both remember this event from 1976.
Right.
And for 35 years.
Yeah.
Both of you walking around with it.
Yeah.
And she gets it. I find that to be extremely touching.
Yeah.
How'd you feel about it?
Me?
When she gave it to you? Too little, too late?
No, I didn't have any resentment about it at all. I mean, it was like one disappointment among, it's life, right? Everybody has this.
Is that typical of your mom to be that way, to think?
No, it isn't. It's not typical at all.
But does it reveal something that is not known to you as a typical? Because to do that, usually in my experience, these individuals, they have a whole set of things they're ruminating on that they regret.
I have no doubt. But it's not something that my mother would let surface very easily.
Yeah.
She's pretty armored up. So that's a interesting, rare kind of event. Who knows why she didn't say anymore, and I didn't think to ask. And my reflection on it since then, because I kept it in my office, is every now and again I'd look at it and I'd say to sometimes my clients or sometimes just to myself that it was a reminder to be kinder and gentler to ourselves, right? Like, okay, so you had this moment where you said no to your kid, doesn't make you, Attila the mother or something.
Well, did you tell this story because you felt in this moment a return to that feeling of, that's right, I don't matter?
I don't remember. I mean, yeah, clearly something like that because
you had this good day where you mattered.
Yeah.
But then this moment with the pencil sharpener returned you, oh, that's right, I don't matter.
Yeah. Something like that. Yeah, I was saying I don't finish things. I don't, because then that'd be a burden. But it was something that Hannah wrote in the thing that brought it to mind. But, quite frankly, sometimes I'm sitting here with you and just stuff spools out.
Yeah.
I don't really know why.
Well, I mean, in a Freudian sense, it's interesting that story emerged as we were talking about taking up space. And given what I know about your life, at least I think the way I'm conceptualizing it is a possibility,
One thing I'm recognizing right now as we talk about it is my own armor and the notion that I don't want to uncover that wound, and I don't want to let her close. I don't want to she's basically apologizing for disappointing me, and I don't want to be vulnerable, which would be required in order to actually have some kind of repair. Mm-hmm. So Something about that made it come up in the thing here, but I can't remember what Hannah.
Well, to be specific, if you did let down that armor and really kind of looked at under a microscope that experience 10 years ago, and maybe what your mom had been feeling chronically over time, what's the fear?
It's like Lucy with the football.
Yeah.
If I let her in, she's just going to do it again.
Yeah.
So, and my mom probably would too. She's pretty defended and very not much insight. So, yeah, you'll see this sometimes with people. They'll have moments of insight and wakefulness, but they're just moments. And they probably are in some ways distortions. Like she may be distorting. I think she actually is distorting the actual impact of that moment, that she feels bad about it because she was probably being petty, but it doesn't mean that her sense of herself is in proportion to the level of disappointment that I was feeling. I'm not actually sure it is an apology to me. It's more like atonement for a sin, which is not the same thing.
Right.
It's actually a really interesting and important thing to distinguish. It's if you're going to look at somebody's injury, you actually have to look at the injury, not what you think about the injury, in order to actually get anywhere with them.
Right. I mean, as you say that, it's like if we just analyze it cognitively, it's in the right direction.
Yeah.
But to be more attuned would be for her, even if we say, let 35 years pass, she comes to you and says, do you remember that moment? Because in that moment, I felt petty, and I've been carrying that around.
Yeah.
But I don't know if you cared. Did it hurt you? And you would say, like, well, what would you say?
I'd say, oh, yeah, I felt a moment of disappointment, but it's not like I walked around carrying it. Don't like paying for a Liberty Bell pencil sharpener. I'm not, dying over here.
Right.
But the thing is that's not a real imitation. Not really, because it's addressing what the, quote, injurer wants to address, not what the injured.
Well, right. I mean, that's what I was, in terms of the role play, I was thinking the next question was, were there things that I did that really hurt you? I have heard of one parent actually doing that for their kid. My therapist I had many years ago, someone I just really love and respect, really terrific therapist, and she told me a story about when her kid was in her early 20s, and she sat her down and she said, here's what I did. These are the ways in which I think I fell short as your mom, and I wanted to apologize. And her kid kind of laughed and said, no, Mom, that was okay. This other thing, though, this thing, that one hurt. And my therapist said, okay, tell me. And was really open, and then offered an apology. It's the only time I've ever heard of a parent offering an apology, but it's weird. It's weird that would be rare, because nobody actually expects parents to be perfect. Nobody does. I mean, but have you heard of many parents who say to their kid, tell me where I fell short for you, I care? Yeah.
I've never heard of that.
It's rare.
I think it's really cool. I really love and respect that about my old therapist.
Yeah.
It's tremendously humble, but it also just seems decent, just decent. And with a nice awareness of, I'm just a parent, I'm not freaking God.
Yeah.
And I'm not freaking the devil either. I'm weird.
Yeah.
So I'm going to act weird. I did act weird, and weird is going to have some ripple effects. And here's my kid, and well, they're probably weird too, and someday they're going to be a parent.
Yeah.
And be a weird one too. And, okay, can we learn about it? Like, if we want intimacy, if we want it, how the hell else are you going to get it? Otherwise, it's just like role playing. Oh, I will be the nice mother, and you will be the nice daughter, and, I really like it. I really do.
Yeah. I think it takes a therapist parent to do, you know what I mean?
Yeah,
like
right.
It's in terms of the style, but I will say that my parents they're not therapists. So in their way, it was less refined, less sort of specific, but both my parents have expressed shame about certain things, because one of the things that we will do when we all get together is talk about our childhoods.
Yeah.
And there'll be stories that will come up but we'll say it in a funny way.
Yeah.
Like, for example, recently I talked on the podcast so I was talking with a survivor of the Children of God cult. Did you know about them?
I saw that you did an episode on that, and but no, I don't know about that cult.
They were a huge cult, like hundreds of thousands of members around the world.
Jeez.
In the 60s, 70s, 80s. And
where were they headquartered, do you know?
Well, they came from the United States somewhere, but they were starting to experience governmental investigations. And so they, quote unquote, disbanded, but they just renamed themselves in these far-flung countries like China and Russia, all over the world. Yeah. And they were extremely just one of the most elaborate cults you've ever heard of. Damn. And, the sex aspects and the control and the lack of relationships with the children were taken away from the parents, and you weren't allowed to marry anyone. They would just sort of, you're getting too close, and they would it was just the whole 9 yards, And so she entered or she was born into it, or she was 2 and her parents went into it or something, and she got out when she was 20. But anyway, in that episode, I don't know how we got on it, but I was talking about how I was relating to something she was saying, and I was like, yeah, well, my dad, we joke about this in my family, that he made us use just 2 squares of toilet paper. This is a huge joke in my family. It was about 10 or 15 years ago that I think I brought it up over dinner once, and I was like, Dad, do you remember telling me to use 2 squares of toilet paper? And then my older brother and sister, my younger brother maybe, but I know my older brother and sister were also like, oh my God, he did that with us too. And so now, like, on Father's Day, we'll give him like toilet paper or something. And so when I was telling the story, I was also saying that when we were being potty trained, and my dad was in charge of potty training us, that our butts are really small. So 2 squares probably is at least close to the amount you need. And if you don't stipulate how much toilet paper to use, some kids they'll use like an entire, bushel of toilet paper, because, kids, they're not very precise or careful or trying to preserve.
And pulling that thing is fun.
Yeah, exactly. Fling, And so I was, as an adult, I would tell my dad it's funny, because I remember to this day when I pull toilet paper off, occasionally I'll think about that, because I'll be pulling off more than 2 squares, and I'll think like, oh, I'm breaking the rules, And my dad was pretty stern. I mean, he wasn't abusive, but he was, and both my parents were pretty boundaried, if you will. I mean, when you have 4 kids, you can't, anyway.
Yeah,
so,
sure.
So it wasn't like, it wasn't a suggestion that my dad gave us, I just remember it was like one of those sort of rigid things that my dad had. And so what was funny was that the cult survivor said, oh my God, I grew up, she's saying, I grew up in a cult, so I feel like I'm an alien from outer space, because so many of my experiences that I thought were completely mundane and normal were so strange, and she says because she was completely cut off. She's our age, but she doesn't have any cultural references to any of the TV shows or bands or, anything that we know. So she's of our generation. She's an American.
Do you feel like an outsider?
But she has no knowledge. Yeah. It's like she was on another planet. So she took pleasure in me telling this story, because she's like, I went through a similar thing about a rigid use of toilet paper when I was young, and I thought that was one aspect that made me even more of an alien, but you lived in the real world and you went through a similar thing. And so she took a lot of pleasure in going like, okay, like there's some things that I can relate to. But when I brought this up, And whenever it gets brought up as a joke, once every couple of years in my family, my dad will make a point to apologize. He's just like, I don't know what I was thinking. He just kind of looks down. He's like, I'm sorry about that. And then I'll tell him like, no, it's fine. Like, as soon as we were pooping on our own, we all broke from the rule pretty quickly, especially as we got older. And it wasn't like abusive, it was just one of those rules that parents have, and they're just trying to do their best. My parents were 19 when they started having kids, and they're poor as well, so it's like you can't go through toilet paper fast, and you just think about all the other aspects of potty training that my dad, it's probably like 150 things that my dad did with potty training that we don't remember because they were done in a flexible, good way or something. There's just all these little things you got to tell a kid about how to poop.
So was he maybe 24, 25 when he had you?
With me, my parents were 27. But yeah, they were 19, 20 when they had my brother.
Can you imagine you're a 20-year-old man, young man, trying to potty train a child?
No, I can't imagine.
Like, I'm 55 and I have no concept of that.
Yeah. So, yeah. And there's, I think, no guidance around that kind of thing.
Right.
And so anyway, my point is that that's one of the things that my parents will actually, in their way, like if my parents were therapists, they would sit me down and say, hey, I just want to tell you, because that's the way a therapist talks. But the way typical people talk is they will express effectively remorse for making mistakes. And I feel it's my job as their child to tell them, like, I hear you, and every parent makes mistakes, but I can tell you as a family therapist and as your son, overall, you did astronomically better than other people that I know. So, us kids, we have our complaints about you, but you should put that in context here. It's like Usain Bolt occasionally doesn't run the fastest race. You know what I mean? It's okay.
You're not great anymore, so we weren't great ever, right? Yeah, come on.
Yeah.
Right? Yeah.
Right. Because my parents took parenting very seriously. It was their whole life. When I look back, it's pretty much all they did. They occasionally would hang out with friends. They never went on vacation without us. Well, my mom did once with her siblings. They went to Washington, D.C., but it was pretty rare.
Yeah.
My dad went to work in the morning, came home immediately for dinner. We all had dinner every night at the table, any sport or activity we wanted to do, for the most part, we were allowed to do, and they drove us, and all their money went into our college fund and, putting a roof up, it was all about us. And so, they take a lot of pride in
rightfully so.
Yeah. And
they're just four successful, beautiful children who,
And so I want them to not feel ashamed of themselves, a little gentle ribbing now and then about the two squares is, it's funny to me. But anyway, so going on with Hannah's email.
Right on.
It seems like I'm always asking for permission or looking to someone else for guidance on what to do, how to feel, and whether or not I am a good person. I feel like I need to look I feel like I need to look to someone else to tell me where the dishes are, which room is my room, and how they like the towels folded. But in my own house, if we're sticking with the metaphor, she's in a metaphor. She's like, I'm in my own house,
right? But
I'm constantly like, which is my room, and is it okay? Like, she's a guest in her own house,
right?
Kind of like what you were saying. When it comes to making decisions, I base them on what other people want or what would please them. When I'm in a room, I try to make myself as small as possible, to the point where I actually find myself controlling my own breathing. I'll take softer, more shallow breaths so that they don't make a sound, and so that my abdomen doesn't rise noticeably. Can you relate to that, Bob?
Yeah, I gave up pizza when I was a junior in high school. because with pizza, it's a very conspicuous consuming kind of food because you get the cheese string and you get the inevitable grease and sauce dribble in your chin or whatever. So I stopped eating pizza because I would be noticed.
Wow.
Similar to what Hannah's saying about the breathing. Do you hear? I hear something else in what Hannah's saying, though, too. I hear tremendous, tremendous longing. I wonder if Hannah hears it.
Yeah.
Like
longing for
air in this case. I just want to breathe. I find myself doing this thing. I recognize that I do this thing. And what's not spoken is, I don't like it. She's not saying that, but she's saying it all the same. There's sanity in that, too. Like, you shouldn't like this. Anyways, what else you got to say?
I'd be really interested to hear if this metaphor resonates with you, Bob. I'd also be interested to hear about how you've continued to navigate through this feeling. And also, Kirk, you featured my comment, my username is Banana Envy, about an increase in suicidal ideation in one of your recent comments reaction videos on YouTube. I wanted to thank you for what you had to say. I saved that section of the video so I can listen when times are particularly tough. My suicidal ideation has decreased significantly in the past week, and I'm grateful for that.
Good.
End of email. Yeah. Well, first off, Hannah, thanks for that, and I'm glad for you. Also, I hope you have a therapist. Did we hear that?
We didn't hear that, no.
Because, suicidal ideation deserves, especially if you're struggling with it, some people, it's kind of in the background, but if it's a particular thing, then it's really important to have a therapist that specializes in that, as you know I've been talking about lately. But
Hannah, don't kill yourself.
Yeah.
Don't.
Yeah. So I guess we answered her question. Just like, I'd like to hear if the metaphor resonates with you, Bob. We basically already answered that. Also, but the main thing that she's also asking at the end here is she'd be interested to hear how you've continued to navigate through this feeling.
Hannah, it's just so great that you're asking. Yesterday, I wanted a new iPad. Apple makes this 12.9-inch screen iPad. And it's a lot of money.
iPad Pro.
iPad Pro, yeah.
Stacy has one.
Yeah. And I've been doing this particularly technical drawing that's linked to my novel, but in the mornings I get up and I write, then I go to work or do whatever I'm doing that day, and in the evenings, after the dust is all settled, I work on this drawing. It's actually almost done. It's really cool. I should show it to you.
Yeah.
I think I have it on my phone, maybe. Anyways, I'm interested in this thing, and it's the kind of thing that I'll look at but not buy. I mean, I think we had a conversation about my pen a while back, and then there was something else. A wallet, yeah. I went 15 rounds around a wallet. So Hannah, this is the thing: is there's a part of me that says, no, Bob, you shouldn't want that. Bob, no, don't want that. And Hannah, money's okay. So it's not like there's a thing it's either that or pay the mortgage. We're okay that way. So last week, Colleen lost her iPad on our trip to Europe.
Oh.
She left it on the airplane, and so she's been kind of just making do without. She's like, I don't think I need one. I've got my phone or whatever. And it's like, okay, fine. And then she started using my iPad, and I thought, well, maybe you want one, and I know you, and you ain't going to buy yourself one. So I went and I bought her one last week, and I showed up. It sat in cellophane on our dining room table for 3 days because she both wanted it and felt really ambivalent about it because, she's like me. She's, do I deserve this? And blah, blah, blah. And one of my great pleasures in life is that I get to participate in her
eating pizza.
I get to bring her pizza and then watch her enjoy it. Right. So she finally opened the thing and she's into it. It's cool. So, but yesterday I fessed up. I said, well, Apple sells this one and it's refurbished and this is what it costs. And I can trade in my old one and get a credit towards blah, blah, blah. And so it'll end up being this.
You're telling this to her?
I'm telling this to Colleen.
Why?
Because I need permission. Except I don't really need permission. It's not like I need her to say yes, Bob, or no, Bob.
Just to check in, kind of.
It's more like I need to know I'm okay if I do it.
Like if she really didn't want you to, she would say something.
Right.
Yeah.
Right. So it's the Liberty Bell. Right. Mom, can I have a Liberty Bell?
Right.
No. Okay. Right. All right. Well, I probably shouldn't have asked. right? So she said, honey, sure, whatever you want to do. And then I think 15 minutes, she's like, I don't know how you do it, but everything's great with us, financially speaking. And, we're in the best shape I've ever been in my whole life, and everything's good. So, obviously whatever you're doing, it's working. So
Colleen was saying that?
Yeah.
So she recently retired.
Colleen Colleen retired about 4 months ago. So the point is reassurance given that hasn't been requested doesn't really do a whole lot for the person on the receiving end of that. Not a whole lot, but reassurance requested from a vulnerable place. Like, am I okay if I like this kind of sex, or this kind of iPad, or Greek for dinner instead of Mexican because that's what you wanted, or whatever. Like, it doesn't really matter. Hannah does it. It just doesn't really matter what the thing is. The mind will impose this template on it that makes us feel like we are guests in our own house, as you say. And so when I screw down my nerve and I have the courage to just reach for Colleen, if she knows what I'm really asking, because I'm not really asking about an iPad, because I don't really need any help with that.
And Colleen knows because you've been in a lot of therapy or talked to her about it?
Actually, you're making me do a redo here, because I'm going to have to go home today because I got to put my money where my mouth is. And I'm going to have to let her know what I was really asking so that she has a chance to really be reassuring. It's really vulnerable. My body doesn't want to do it. I find myself skirting around it. I'm telling you guys that I'm skirting around it right now. But when I do reach for her, it's kind of like swinging out on a trapeze and you do your triple somersault and you hope that the other person's there with their hands to catch, right? But in order for the catch to have any meaning, you have to have the risk of falling. Mm-hmm. You have to. Otherwise, it's not a thrill.
And the metaphor implies it's some sort of death-defying, difficult thing when it's not. If Colleen understands the landscape, and
right,
which she does, then all she says is with a heartfelt thing. It's like, I want you to be happy. Yeah. Please buy it.
Yeah.
It's not hard for her to say that.
No, she'll catch me with one hand.
Yeah.
Yeah.
But you have to cultivate it.
You have to cultivate it. And partner needs to know what they're being asked. Yeah. And that, Hannah, is where I think the healing is. Mm. And it's not just like a one and done. It's like one and done today, and now tomorrow, and then tomorrow, and tomorrow. And probably for the rest of our days.
1 in 10,000 done.
Yeah, right. Yeah, right, exactly.
But you're much better at it now than you were 10 years ago.
Yeah.
Because of those corrective experiences and the awareness in your relationship around that.
Right.
Yeah.
So, Hannah, I hope there's something in that for you.
Yeah. All right, let's take a break. Come back. More emails. What do you say, Bob?
Yup.
All right, we're back from the break. Anonymous upper tier patron, she says, during Johnny Depp's testimony, you noticed that he chuckled slightly while relaying painful memories of his childhood abuse. Mm. You said that laughing could be normal for victims of abuse when telling their stories. Mm-hmm. This reminded me of when I had just left my extremely abusive husband and was seeing my first therapist. It was the first session, and I was giving her a summary of the abuse I went through. I was nervous and unsure about the therapy. As I was relaying this awful abuse, I unconsciously laughed, similar to Johnny Depp. In hindsight, I feel like it was a way for me to downplay the severity of the abuse and to express the ridiculousness of it, rather than the distress it caused, so I would not lose it and break down crying. Mm. But when I did this, my therapist stopped me and frowned at me. Mm. She asked me why I laughed. Mm. I was caught off guard and didn't know what to say, so I think I said something like, I don't know. Then she told me what I was saying was not funny and to stop it. Mm. I felt like I had been chastised by a teacher or a parent. Right. I felt ashamed of myself and really self-conscious from then on. And although I got some positive things from this therapist, I was very careful about laughing inappropriately in the future. Looking back on those sessions and after many years of working on myself, I feel like my first therapist could have done something differently to express the fact that laughing was incongruent with my experience. Any thoughts on that, Bob?
Yeah. I've done that. I've made that bonehead mistake, and I think it's sort of like 2 squares of toilet paper.
What do you mean? Trying to be helpful,
but stuck in my own, young rigidity.
Oh.
And so learning how to step back and do I really care about how many squares of toilet paper? Can I be interested and curious? Mostly that's what I'm interested in doing, is becoming more and more interested and curious about what's happening for a client, and then having, finding a way to talk about it, to learn about it, really to learn about it, not for any kind of correction here, but hey, what is happening? It's not that there isn't an incongruency in superficially speaking, but the body handles tension lots of different ways. Sometimes laughing. With couples, I've seen partners laugh at the quote most inappropriate times, but really it has nothing to do with humor or amusement. Everything to do with extreme discomfort. I mean, it's their partner. So yeah, I think I've been that therapist, and I think it's a bonehead mistake.
Yeah.
And hopefully that therapist, figured out that it didn't really matter how many squares of toilet paper, and kept going, kept learning.
Yeah. Your therapist did something I think quite common, as Bob is pointing out. And the premise is good, but the delivery is bad.
Yeah, exactly.
That I think the analogy that I would have is when people stop at a stop sign when they're in the middle of a flat desert and there's no cars around, or at a stoplight, and they're just sitting there while it's red because, and right. say the light's broken, and they just sit there for 3 days following this rule without really taking into account the meaning of the rule, right. or the reason for the rule.
Right.
And so in the beginning, you have a young trainee who is learning about these kinds of things. And at some point they learn that when people laugh inappropriately, because actually there's a whole segment of assessment regarding appropriateness of emotion and incongruency, and you're trained to identify that, and especially in the first session, like an MSE, mental status exam element. And then you have this other element that you learn about commonly, which is that for some people during abuse recall, they will laugh, and it's not something that, trainees will get this message that's kind of simplistic, that's a bad thing, essentially, is what they get.
Yeah.
But the more complicated, more rational, or I don't know, advanced way of thinking about it is that, as you were saying, Bob, you flag it in your mind, I don't, especially in the first, it was the first session.
Yeah.
You flag it in your mind, and even if it's session 10, if it's the first few times it happens, you just sort of note it and read the room. Because if someone is in the middle of talking about their abuse and it's in the first session, and you're like, maybe this is the first time they've ever talked about it, maybe a higher priority is just making them feel comfortable having told this story in therapy for the first time.
Right.
Down the road, it's possible, but maybe not, that you will address this, because it's possible that as they become more comfortable, they'll just stop laughing, quote unquote, inappropriately.
Right.
But say they continue to do that, then again, you read, the goal is not to shut them up and getting them to stop laughing. The goal is to help them to feel entitled to have the real emotion that's going on for them, which is pain and fear.
Yeah.
That they don't have to sublimate to laughing for the therapist's benefit. I can take it, and I'm not going to hurt you if you tell me that this was a terrible experience for you. I know why you do that. And if you want to continue, and that's the other thing that people don't understand about defenses sometimes, it's like, people come to therapy because they have problems. I say that, and so people have defenses because they need them. And so to just strip that away in the first session and say, stop laughing, maybe that person needs that defense to cope with their life. So the notion of just shutting that down. Now, it's possible that the therapist read the room and thought that it would actually given all the factors that I said, they considered all those things and said, well, I think this is actually still going to help, because there's a compassionate motivation for some therapists when they're doing this. It's a bad move, but they think they're being compassionate. Yeah. They think they're actually saying, don't laugh because I care about you and I want you to feel safe enough to really be truthful about how you feel. You don't have to do that for my benefit. Like, they think they're actually giving you a gift, but if it's delivered badly, it'll just shut people down, which is really awful to think about, you know? Now, it sounds like you got a lot of positive things from the therapist, or you say some positive. So, you know, there's that. Yeah. But then you go on, how would you handle a client who laughed while relaying horrific and stressful experiences? Would you mention it to them? I think I kind of answered that question, but generally speaking, I don't. Like, because of the reasons that you're saying, anonymous upper tier patron, because I don't know when I learned this or kind of figured it out, but I think it was fairly early. I started noticing that some therapists were extremely simplistic in their technique. And this was one of those things that I noticed, these sort of rules that people walk away from graduate school or supervision from. Another one was never cross your legs or
fold your arms.
Never give advice. You know, these kinds of things. Or another one was never say, there's some phrase you're not supposed to say, like never say, I know how you feel. Another phrase is never ask someone why. Literally one of the rules that some people will walk away from graduate school as a therapist. How is it taught to you?
Don't use the word why, ask how.
Yeah.
Or what.
Right.
So like, same question, but not with the word why, with the word how or what.
Yeah, literally never say the word why.
Don't say why.
In therapy.
Yeah.
Which is ridiculous. There are so many uses for the word why in therapy. And it's such a dumb, simplistic, ham-fisted way of trying to be a good therapist.
It is. It's ham-fisted. It's not that there isn't something about the word why that can be off-putting.
Yeah.
It's not that. But really what they should be training us to do isn't to figure out what language to use, is how to be curious, how to be interested, how to take a freaking breath.
Well, also with why, I think, and I don't know what you think about this, but I think the reason why they have this stupid rule is because some idiot therapists will ask why in a way of invalidating people. You know, someone will say, I feel bad because, you know, my relationship isn't going well. And the therapist will be like, why? You know, it's the way they ask it. It's the intent is, you're dumb for having that feeling. And it's like, if we need to tell someone to not do that, like we're lost to begin with. And if we have to say don't, because there's so many other ways to be condescending or non-curious without using the word why. And I remember thinking this early in my career, and I think that when I first started really realizing it and getting upset about it was I was a professor, and I would hear from other students coming to my class, and I would be talking about, and, you know, I might say, so I was talking with a client and they said this, and I asked them why, and then someone raised their hand. It's like, we were taught we're not supposed to say why. And because I don't think I remember being taught that particular rule. I remember being taught don't cross your legs and all these other simplistic, stupid things. So early on, every class I taught, at least once, I felt like I had to dispel some of the stupid shit they were learning in other classes.
Right.
And they were learning a lot of good stuff.
Yeah.
But there was some stupid shit they were learning. And so I felt like so I think that's why I'm so, I've never, or I don't remember falling into those traps, because from the age of 26, I've been actively fighting against these kinds of things. Like, don't laugh when you're telling your story of abuse. You know, it's these kinds of rules that make me look like a very good therapist in this very simple way. You know what I mean? Because I can give it context. You know, I'll literally role play a therapist who crosses their legs and their arms and provides empathy, because you can. I can provide tremendous amount of empathy. and care and good technique while crossing my legs and my arms, because that doesn't matter.
It doesn't really matter. No.
It's such a stupid fucking rule.
Right.
Like, the rule should be make your client feel as if you're open, however you get there.
Yeah.
And if you have to, I don't know, it's like those dating advice YouTube videos of,
Oh, I don't know those.
or these ways of talking to people. They'll say, like, if you really want to mess with someone, if you're trying to gain power in a social relationship, look at their forehead. Look at the middle of their forehead. Have you heard this one?
No.
This is all over TikTok. They're like, if you want to, I don't
Power,
know.
huh?
Sometimes it's, there's a lot of TikTok videos about how to gain social power. They won't word it that way. They'll say, if someone's gaslighting you and you want to protect yourself or something, or get back at them, stare at their forehead.
Huh.
And I'm like, well, one, if they notice you're staring at their forehead, yeah, it'll make them uncomfortable because they see that you're staring at their forehead. Or, I don't know, like it's little stuff like that. And I feel like in therapy, we should be smarter than that anyway.
Yeah.
Anonymous or annual upper tier patron Ellie from God knows where. She literally wrote out from God knows where.
Right on.
She says, I would really appreciate Bob's input on this. He often has a perspective I don't expect, but that resonates deeply with me. And I appreciate so much how he talks about the experience of disorganized attachment. Occasionally, he puts into words something I hadn't been able to articulate before in a very healing way. Thank you so much for all that you do.
Thank you.
Ellie,
thank you.
I have been in therapy on and off my whole life, and what was misdiagnosed as bipolar disorder as a teenager, but was diagnosed as having PTSD and disorganized attachment. I have been working with a wonderful therapist who specializes in trauma for 2.5 years and have made a lot of progress. Lately, I have been struggling a lot, and how to understand my own perceptions of reality. In a lot of your YouTube and audio episodes, you discuss distortions and how when we are triggered, our experience of the situation might be heightened or impacted by our relational traumas, which makes complete sense to me. However, in my therapy, my therapist is constantly encouraging me to trust and believe my own experiences, and I'm struggling to reconcile these two things. How can you parse when you should trust your own experience and when you should not? Bob, what do you think?
Well, I'll take a run at this one. Your experience, whatever's coming up for you, is a source of information. So you can always listen. You can always pay attention to it. Like, what am I getting in my body? What am I getting, and what can it tell me? Sorry, I'm having a alternative thought. My writing teacher says everything you write belongs in the story, either as it is or for what it leads to. So everything belongs in the story, but maybe not what you wrote. Like, I wrote something the other day that really doesn't belong, but there's some part of it that it'll fit, but not the way I wrote it. And so it's fine. I'm not going to toss it. So, okay. So Ellie's asking, so should I or should I not trust my experience, and how the hell do I tell the difference? Well, I think first thing is your experience is your experience. So at least acknowledge it. So if your spider sense tells you that, like my spider sense might tell me that, say, Colleen's upset, right? And there can be a real dissonance when I say, well, obviously you're upset. And she's like, well, no, I'm not. Like, okay, well, there's dissonance. Now, I'm a pretty smart man. So, and I do this for a living, and I've got pretty good intuition or whatever. So I'm vulnerable to hubris and saying, well, I know better, right? But Colleen really is the best reporter of her inner world, better than I'll ever be. So then for me, there's this dissonance that's really uncomfortable. It's really uncomfortable to believe one thing and to be invited to trust something that is often opposite of it.
Feels like you're being lied to.
Yeah.
And that feels very unsafe.
Yeah, right. Yeah, really unsafe. So
why did the writing thing come up?
Oh, because it's not that I want to dismiss my experience. It's a source of information, but it may not be pointing directly at the reality of now. Right. So something I can learn from it is, oh, here's another.
Like you don't have to completely discount
No.
your vibe, but maybe the interpretation is a question mark.
Yeah, the vibe. Yeah, maybe the vibe means something about now, or maybe it really is just a reaction in the present in terms of the past.
Like you're not. Yeah, that's interesting. That's great. Actually, it's like the prompting of the conclusion is valid.
Yeah,
but the conclusion might not be valid.
Might not be. Yeah.
So all you got to do, you don't have to erase your entire experience. You just have to walk back the conclusion you made based on what's happening with you.
Yeah, which really, in many ways, boils down to holding both ends, which is Colleen is telling me X, and my body's telling me Y, and I got to hold them both. And that's really uncomfortable because security is going to be found in aggressive certainty. Well, I know better, blah, 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 blah.
Yeah.
And that actually ultimately doesn't do me any good.
Well, in that situation, what are the possible truths or facts that you could point to that are okay to acknowledge or safe to acknowledge? But so you have to walk back the conclusion that she's upset.
Yep.
But what's the thing you can rely on more readily?
Something's kicked me off.
Yeah.
I'm upset. That's the fact.
Yeah.
Or whatever it is, my spider sense is tingling or whatever.
Or she's maybe perturbed about something else, or she's tired.
Or right.
Or she's a little put off by your attitude because you believe she's upset at you or something.
Sure, right. That would not be a rare event at my house.
Yeah. So she's not upset about the thing you thought she was upset about. She's upset about being accused that she's upset about.
Being thought of as upset.
Yeah. Right.
Well, I'm angry now.
Yeah. Or she's slightly perturbed, but really she knows that she's okay.
Yeah.
She's not resentful or anything.
Right, which can happen, right? Yeah, we're getting Mexican instead of Greek, and maybe she's bummed about that, but it's worth it. It's like, okay, well, Bob wants Mexican food tonight, so okay, fine. And yeah, am I disappointed? Yeah. Is that okay? Yeah, they're both okay. Right. So there might be that something kicks off. Maybe it is something happening in the now. I don't know. I'm not probably never really know, but the opportunity here is for one of vulnerable trust. In my case, vulnerable trust in Colleen, that's a good bet. That's a good bet. But I got a Colleen. I don't know if Ellie has a Colleen or someone like that. So Ellie, I think it's okay to hold it, but not, as Kirk says, not hold its conclusion, and live with the dissonance and continue curiosity if you want.
Yeah. In case anyone's wondering, a siren car, aid car, just went by in our neighborhood.
Oh, I thought that was a coyote.
Yeah. And there's all sorts of noises happening in my neighborhood right now. And I have the window open because, I don't know, it's just nice to have some fresh air. So there's that. But Ellie...
Kirk, are you upset about the noise?
I am. It fucking bugs me.
I knew it.
Yeah.
I knew it.
It's like, knock it off. I'm trying to podcast you. And what I'll say, Ellie, is that, one, listen to your therapist, not me. I mean, you're saying that I'm saying that people can distort, which is generally true, but your therapist knows you specifically. So your therapist, I would trust your therapist. I would not think, well, Kirk says that I might be distorting. I never said you might be distorting. I said people might distort. So I'd trust your therapist. The second thing I'll say is, it's possible that your therapist is erring on the side of, let's not question your experience at this point, because that's not a helpful road. And it's possible, Ellie, that you do that way too much. It sounds like you probably do. And your therapist is therapeutically trying to really help you to not do that so much.
Oh, that's the pendulum.
Yeah. And it's also possible that, so I would think that.
Yeah.
There's a slight possibility that your therapist is the sort of therapist that just doesn't really like to play in that area where a client might be distorting, and for various reasons, or isn't comfortable talking about that with you yet, but your therapist might actually think that's possible. So if I were you, Ellie, what I would tell my therapist is I would say, I really appreciate that you're trying to help me trust my feelings. And I clearly have a problem with that. Or at least I'll trust your opinion that I have a problem with that. I also sometimes think I might be distorting kind of, because everyone does. And I don't think that, I probably think I'm distorting more often than I am, but I'm curious because I feel like everyone will filter their experiences through their emotions. And
right.
I just like to add that to the repertoire of things we talk about.
Love it.
Yeah. So if you did that, or that's what I would say, and I don't know how the therapist would react, but it's possible that the therapist would be like, oh, okay, well, that makes sense. But it's also possible that you bring it up way too much because of your traumas, and your therapist is actually actively really trying to establish this firm foundation that, in general, Ellie, you should trust your feelings and your interpretations of things because you've been gaslit your entire life because of whatever you went through, the disorganized attachment trauma, the PTSD trauma. And so, that's what I would say. But yeah, don't listen to me, listen to your therapist. All right, Bob, that does it for that episode in which we answered upper tier patron emails.
Yeah, we got through several, more than usual, I think.
I mean,
Average?
there's still 25 pages of emails.
Okay.
But they keep getting added to. And everyone out there, please take care of yourself because
you deserve it.